scare you. This is so you can make responsible decisions as you get older. Okay? Okay, so the first part is, what is alcohol? Alcohol is known as several different things. You can call it booze, hooch, brew, moonshine. There's so many words for alcohol, but it's mostly known as alcohol or booze. It's a depressant drug, so what it does is it affects and slows down the part of your brain that's responsible for making decisions, thinking, behavior. So that's why when you see someone who's under the influence, they kind of seem a bit stupid almost, like they don't really know what they're doing. Their alcohol slows down their responses. Okay, so alcohol is made by fermenting and distilling fruits and vegetables or grains. That's why you hear things such as potato vodka. It's made of potatoes, right? So, and wines are made out of fruit. So you'll get like a cherry wine. It's made out of cherries or grapes. Beer and wine is fermented, and hard liquor like vodka, whiskey, and spirits are distilled. Distilled alcohol has a higher alcohol content. Beers, I think, are 6% alcohol, but if you get 1 ounce of whiskey, that's 40% alcohol. You have a question, Emma?
Is wine like that better than beer, or is like which one affects you?
Well, it really depends on yourself, right? The older you are, your body content, like if you're a larger person, smaller person, how long you've been drinking, all affect how alcohol affects you. But wine is 12% alcohol and beer is 6 or 7. So content-wise, wine is stronger than beer. But it's all really the same. Here's an example. So in 12-ounce beer, there's 5% alcohol. In a 5-ounce wine, there's 10 to 12. In a 3-ounce fortified wine, there's 16 to 18. And 1.5 ounces of liquor, there's 40% alcohol. Okay? So how long does alcohol last? It takes the body roughly an hour to metabolize 1 beverage. So if you're drinking 1 alcoholic beverage an hour, it shouldn't affect you too much because your body's metabolizing it at a rate that your body can handle. Drinking heavily, like if you're having way more than 1 drink an hour, say you're having 3 or 4 drinks an hour over 6 hours, it's called binge drinking, but it's also could result in a hangover, which comes normally in the morning. You wake up and you feel ill because you have a headache, you're you have nausea, diarrhea, shakiness, you get shakes. Can't control this, right? And sometimes you vomit. You vomit up the alcohol because your body's trying to get rid of it. This is what all this is. Like when you go to the bathroom, your body's trying to get rid of all the bad stuff that's been in your body for 12 hours. So, history of alcohol. Alcohol is not a new thing. It was discovered 10,000 years ago. It was used a lot in religious ceremonies like it is now, especially wine. It's used for trade back thousands of years ago. People would make wine and sell it to other countries for profit. And a lot of wars started from alcohol because some people wanted certain types of alcohol, and if another country didn't sell them that, it could start a war, much like any other kind of trade. And it was also used for medicinal purposes. A lot of the time, alcohol can clean cuts. It would hurt, but it can clean cuts. A lot of time, people believe that alcohol can help cure colds. There's actually medicinal alcohol. If you've ever heard of Jägermeister, and I hope none of you guys have, it's actually a cough syrup that people in Germany used to use. But it's about like 40% alcohol, and it will, if you drink a lot of it, it'll get you pretty intoxicated before it'll cure your cold. World War I, there was prohibition in Canada. It was seen as a patriotic duty and a social sacrifice. It was supposed to help everyone win the war. I'm not entirely sure how alcohol and World War I had anything to do with one another. But because of prohibition, there was a rise in bootlegging and speakeasies, and that's basically people would produce illegal booze and they would sell it to speakeasies, which were kind of like illegal bars. You weren't allowed to have them, but people would go to these bars and they'd consume alcohol and all that stuff. And then that, near the end of Prohibition, we have another question?
When did alcohol become illegal?
Alcohol became illegal in different parts of Canada in 1902. And it didn't, in Ontario, I believe it was illegal to 1927. So it was illegal for like 10 years, I think, in Ontario. But not a long period, but for a lot of people, it was. People believed that it violated traditions of individual liberty. So that's how people passed kind of reverse prohibition, that it was suppressing their individual rights to consume whatever they please. So who uses alcohol? In Ontario, you cannot legally consume or purchase alcohol until the age of 19. So that's a long ways off for many of you. Yeah, and it's also illegal for people older than 19 to purchase people under 19 alcohol. So I couldn't purchase one of you guys alcohol because that's illegal for me to do, even though I can legally purchase alcohol. However, so 77% of Canadians aged 15 and older report drinking alcohol in the last year. So it's a large number. A lot of people drink. It's not a bad thing, but it can lead to bad things, which is the important part. So men drink more than women typically, and are more likely to develop drinking problems typically. This isn't always the case. There's women who have drinking problems, but statistically, it's men who have more problems. 55% of grade 7s, 2 grade 12 students admit to consuming alcohol in the past year, and 22 have drank 5 or more drinks at least once in the past month. So if you consume 5 or more drinks in one occasion, that's considered binge drinking, and it could really damage yourself. And I'll explain more of like the symptoms and the risk factors to drinking. So signs and symptoms of someone who's intoxicated. This is someone who has had way too much alcohol. They kind of stagger, they can't walk in a straight line. They have glassy, bloodshot eyes. They fall down a lot because they don't have any control over their mobility. They have a flushed face, so often they're really rosy in the cheeks. They vomit, not all the time, sometimes that's just in the morning, but you do vomit occasionally. Drowsiness, so it makes them really sleepy because it's a depressant drug, it makes you want to go to bed. Behavioral signs, you slur your speech, you can't talk properly. Sometimes you can become violent. A person consumes alcohol, they sometimes behave in a way that's not typical of themselves. And they also engage in risky behaviors. A lot of the time people drink and consume alcohol and they're not really aware of what they're doing. They may engage in violence, they may drive under the influence when they normally wouldn't. They may engage in risky sexual behavior, which comes with a whole other territory of risks. Okay, so once alcohol is consumed, it is absorbed through your gastrointestinal tract and then diffuses into the blood and carried throughout the body. So that's why you hear a blood alcohol content. So blood alcohol content is your alcohol divided by your total body of water. So that's why you hear of people being arrested for having a 0.08 blood alcohol level. That's over the limit that you can drive with. So that's what that is. That means there's 0.08 grams of concentration of alcohol in their bloodstream. The liver metabolizes 95% of the alcohol. The rest is done through sweat, breath, urine, and your saliva. And like I said earlier, the body metabolizes 1 standard drink an hour, roughly give or take a person's size and level of drinking. If you develop a tolerance to it, it will take your body slower to metabolize. Okay. So alcohol impacts the brain and your overall health in a lot of different ways. These are the factors that influence how and what extent the alcohol affects your brain. And that includes how much and how often you drink. If you drink once or twice a year, it's not going to affect your health very much. Some people believe that it is in some ways beneficial to drink. that it actually improves your heart function and all that stuff if you drink a small amount, not very often. A person's age at which you began drinking and how long you've been drinking. So if you've been drinking heavily since you've been 14 and now you're 40, you're probably going to have a lot of health risks, versus if you didn't start drinking until you were 20 and you only drank occasionally up till the time you were 40, you're not going to have nearly as many health risks. A person's age, level of education, gender, like I said, men become addicted more often than females. Men also metabolize alcohol at a quicker rate, and it also doesn't affect men the way it affects women, because we are generally smaller, less muscular, all that kind of stuff. Genetic background, if you have a history of alcoholism in your family, it's going to affect you more than it would if you didn't have it. For example, if your mother drinks like 5 drinks a night, they say that you're more easily susceptible to alcoholism when you start drinking. And your general health status, if you already have a poor health status, chances are alcohol is going to affect you a lot more than it will someone who's a healthy individual. Okay, so the next syndrome is the Wernicke-Korsakoff syndrome. It's a mouthful. And these are 2 separate syndromes that affect your vitamin B1. So it's found most often in people who suffer from alcoholism, although people sometimes develop it when they have a deficiency of that vitamin. But it causes disorientation, memory lapse, abnormal eye movements, and poor coordination over an extended period of time. So you could be sober and experience these movements, but that's just the effects of this syndrome. Another aspect that's a short-lived aspect is blackouts. If you consume a large quantity of alcohol, you may have a memory lapse, which is when you don't remember a specific period of your night. It may be 5 minutes, it may be 3 hours. You may not remember how you got home that night, you may not remember who you were with, what you drank. All of these things play a role, and that's a scary thought. Can you imagine waking up one morning and not remembering how you got to bed? Like, I think it would be extremely terrifying. And then, because people black out occasionally, they may be engaging in risky behaviors that can be extremely dangerous, like unprotected sex, other drug use. Some people engage in while they're under the influence, and just other risky behaviors, like getting in the vehicle with someone who's been drinking or driving yourself. Alcohol suppresses the immune system, which makes you more susceptible to illnesses and diseases. So your immune system is what keeps you healthy. So when the alcohol suppresses this, you're more susceptible to getting sick, to getting cancers, which cancers such as breast cancer and larynx disease. You can also get liver disease, because the liver is responsible for breaking down alcohol and clearing it away from the body. However long-term drinkers, it damages your liver. And I'll show you a video that really demonstrates this. Damaged liver cells allow harmful substances to enter the brain, which causes damage to brain cells. So by drinking, you're damaging your liver, you're damaging your brain, and you're just damaging your overall health, even though you might not think the two are even related. And it also could cause cardiovascular issues like strokes, high blood pressure, stuff like that. So, right over here, watch this video. Hopefully it'll load. Okay, now this video demonstrates the effects of the liver when you drink heavily for an extended period of time. This is Dr. Drew. I don't know if any of you have seen his show. He has 2 twins who have been drinking heavily for an extended period of time. I'm not entirely sure why they're dressed the exact same, because they are in their 20s, but ignore that part, they look a little silly.
Alrighty, so what we have here is a cross-section of a normal liver. There it is on camera. You see how its architecture is relatively intact, the color is relatively homogeneous. This is, would you like to hold it all?
That's a real liver.
That's a real liver. That is somebody's liver, so let's be respectful of that. So this is what a healthy liver should look like, Terry.
I guess I've held a human liver.
Is it?
Wow.
Okay, so that's, again, particularly notice that the architecture is uniform and the color, and there's a homogeneous quality to it, okay? This now is going to be a cirrhotic.
Oh, wow.
Yeah. And these are all regenerative nodules. The liver is full of scar, and it's attempting to regenerate itself, and as it regenerates, it comes up against scar and forms more scar.
How long does this take?
To develop?
Mm-hmm.
Well, women are at about a 5-time greater risk of developing this. Well, you have, no, it's not the size, it's that you actually lack an enzyme in your stomach to break the alcohol down into a safer compound. And essentially, every woman I've treated that drink like either of you do has some degree of alcoholic liver disease. It's not possible that you don't have alcoholic liver disease. I can't say that you have cirrhosis. Not everybody gets cirrhosis, but I worry that you are at risk for cirrhosis. This is a mess. Right? This is probably somebody who died of cirrhosis. And what happens is that not only are you unable to take toxins out of your system, and it can affect your brain, it can become what's called encephalopathic, you can't build proteins normally, you can't fight, your immune system doesn't work normally, blood backs up behind the liver, and you actually develop varicose veins in your esophagus, they rupture, and you can bleed to death in minutes.
So that just shows you how much alcohol really does affect your liver. As you saw, the healthy liver functions at a normal rate. It breaks down all these chemicals and bacteria that's inside your body, and the unhealthy liver can't do that. So you could die from that. That's an extreme binge drinking scenario. Not everyone develops a liver like that if you drink. Because a lot of people drink, as you saw, 77% of Canadians drink, and not 77% of Canadians die from liver disease. It's when you drink an extreme amount of alcohol for an extreme amount of time. Okay, so alcohol poisoning. This is what happens when you drink so much alcohol that your body just kind of gives out on you. Signs of alcohol poisoning is confusion, vomiting, seizures, slow or irregular breathing, low body temperature, blue pale skin, and passing out. So what actually happens is that this can kill the person if they drink so much alcohol that they pass out, and they can actually choke on their own vomit and suffocate themselves. I know people who this has happened to, and they have actually passed away. It's not like someone got alcohol poisoning. No matter what happens, if you have alcohol poisoning, you're gonna be extremely ill, or you're gonna have to have your stomach pumped out because your body can't handle that much alcohol. Okay? And there's another video that we will watch that really demonstrates the effects of alcohol poisoning. Once again,
Dans les restaurants Subway, le réconfort, c'est une chaleur enveloppante, des moments tendres, des saveurs invitantes.
It's in English, don't worry. So this is a show called The Doctors, and they talk about the dangers of alcohol poisoning. This is this show from the United States, so their drinking age is 21, so when they talk about 21, it's 19 for us. They also talk about how it affects college kids. It really affects anyone who drinks a lot. Anyway, so we'll just watch this. It's a little bit longer than last clip, but not as graphic.
Real problem in college is because you're drinking an obscene amount of alcohol, and all the effects of that alcohol may not even be at play until you pass out. You can literally pass out, your blood alcohol concentration can continue to rise if you're drinking hard alcohol like rum, bourbon, other hard liquors.
And this is the first time a lot of times the kids turn 21 in college, the first time they've ever had alcohol, so they may not know what
They
their
have no
limits are.
clue how
Yeah.
much they can consume and what's too much.
And the reason that people die is you have involuntary reflexes that are basically knocked out if your blood alcohol level is too high. So think about how often you drink a sip of water and you start coughing, oh, it went down the wrong pipe. Well, if your blood alcohol level goes beyond a certain point, that gag reflex no longer works, and so you can asphyxiate in your sleep and die. And I want to show everyone really quickly how blood alcohol concentrations affect your judgment. And why this often happens is because, innocently enough, you may start off, have a drink, and you start to feel relaxed. Your intensification moves,
That's the
then you get a
BAC.
little
That's
sedation. This is
that's
where you
the
start to
blood
wonder, driving may not be such a smart idea. Maybe after 2 or 3 drinks, you're starting to get impaired motor skills. 0.08 in many places is an illegal level of blood alcohol concentration as far as DUI. So things are beginning to be impaired. Not only dangerous yet, but this is, I want everyone to focus on this. Significantly impaired judgment. Significantly impaired judgment. You know what that often means? I'm going to keep on drinking. This liquor, it's not touching me. Often happens in college kids. Then once they get confused, they may even be close to blacking out, but their friends are giving them more and more shots because their friends have impaired judgment. This is where things get kind of scary. Between 0.3 and 0.4, for most people who are naive to alcohol, you can start to lose consciousness. And then beyond 0.4, again, if you're alcohol naive, you can go unconscious. That's how you die. Now, what's crazy is I have seen full-blown alcoholics walking around the ER with levels of 0.4 plus because they're so used to having that much in their system. But a college kid, theoretically, maybe that's the first time they've ever even had alcohol.
And what happened in the story, he kind of passed out, so the people around him figured, oh, he's sleeping it off. He needs to sleep it off. Let's put him in the bed, let him sleep it off, check on him in the morning. And that's often the wrong thing to do because, like you said, you lose your gag reflex, your breathing's suppressed, and you can just wake up.
And the people around them probably have impaired thought process as well. Like, are they thinking safe? Are they being extra cautious? Probably not.
And let me ask you this as parents. If your children ever called you up and said, you know what, my friend is not responding, drank too much, I don't think you would ever be upset. You would be there in a heartbeat. So if you cannot
I got that exact phone call, but it was from my daughter's friend. And but yeah, I'm very thankful that my daughter's friends were around her to say, hey, but you need
Did
to
they call
prepare.
911?
No, she was just on the verge of the passing out aspect. By the time we got there, she was out, and I was able to check her and kind of help her ride through it. But
New
yeah,
experiences with alcohol, and as long as they know, you call them, there'll be no questions asked, as long as they're safe.
yes, and I told her, that day when she goes to the graduation party, I said, if you need to call me, no questions asked, you call me, and luckily.
And most colleges have a healthcare facility because if you cannot get your friend to respond to you, they need to be in the emergency department where they can be closely watched, be given IV fluids if necessary, and more importantly, sometimes you need a breathing tube to get you through the night. Otherwise, you will not wake up the next morning.
Okay, so they bring up a very good point. When in the future, when you guys start engaging in alcohol and those kind of behaviors, if you ever have a friend or even a stranger who is unconscious, not responding, even if you don't even know the person, you really need to take steps to ensure that they're okay because people die from consuming too much alcohol. It's a fact. People can pass out from the alcohol they've consumed and never wake up. And yeah, Emma?
So when you black out, it also it impairs. You don't think properly and you're encouraged to do things that you should do.
Yeah. Well, when you black out, you're not necessarily unconscious. I could be right now, if I was under so much influence, I could be blacked out. No one else knows this. I don't even know I'm blacked out till the next morning where I'm like, man, the last thing I remember was getting to the bar and it's now 8 o'clock in the morning. How did I get here? So it's not that you're unconscious for that period. You can be totally awake. You're not aware of what you're doing because you're making the decisions, but your subconscious is. You're not really consciously aware of what you are doing. So that could be engaging in risky behaviors. That could be drinking even more because you're not already intoxicated enough that you think another shot's not going to kill me, and you just keep drinking because you don't really know what you're doing, right? So it really is, blackout is like, can lead to alcohol poisoning because you don't know really what your limit is in that aspect of things. Okay. So another really important aspect of alcohol is fetal alcohol syndrome or fetal alcohol exposure. So this is what happens when you're pregnant. So us females, when we get pregnant, our babies cannot kind of consume alcohol the same way we can. So alcohol does not pass through the placenta to the baby. So it blocks the baby from getting oxygen and nutrients, which causes this syndrome called FAS. Alcohol is more concentrated in the fetus. That's why it prevents the fetus from getting nutrients and oxygen that help it develop and function and grow within a woman's stomach. Okay, so this is what they think a typical FAS face looks like, right? So you got a farther distance between your lip and your nose, and it's flat. They say you have a smaller head, your eyes are far apart, you have like a little flap of skin right there, you have a low nasal bridge, a short nose. They say this is what a typical FAS child looks like. This isn't always true. Some people display these characteristics even when they don't have FAS. Some people portray these characteristics with FAS. It's really dependent on these kind of symptoms. So they display abnormal facial features like this. They have hyperactivity or a lack of focus, poor coordination, delayed development. So often they're 12 chronologically, but their developmental age is more like 6. So they behave in a way that reminds you of a 6-year-old, but they're 12 kind of thing. It's what some people would be like, oh, they're so immature. It's just some people just have a delayed development. Poor judgment, problems seeing or hearing. Sometimes they'll have a learning disability, heart problems, kidney defects, deformed limbs and fingers, and often mood swings. So not every FAS kid has all those. Some parents who have consumed, some mothers who have consumed alcohol, sometimes their kids don't have any of this. Sometimes their kids are perfectly fine. And other times, it doesn't take much alcohol. So early diagnosis is key to ensuring that a child is connected with the necessary resources, because there's no medication that magically makes FAS go away, because there's so many symptoms. So you need to really find the right treatment. And FAS isn't curable. It doesn't matter what kind of medication you give them, what treatment they have, they'll always have FAS. Alcohol plays a role in the spread of STIs, especially HIV/AIDS. It's a really big one. So basically, alcohol may contribute to the spread of HIV because you engage in risky sexual behaviors and you might not use protection when you do these things. Alcohol impairs your judgment. So what you might not do sober, you might do when you're under the influence. That's not to say everyone will, but some do. Drinkers statistically also delay testing and treatment for HIV, maybe because they're embarrassed by it. Those who abuse alcohol may have difficulty taking prescribed medication, especially considering alcohol and medication don't really go hand in hand. A lot of the times, medication and alcohol, it overwrites one another, so the medication won't work if you're consuming a lot of alcohol. And liver disease, as you found out, it reduces your immune system, which makes the progression of HIV more rapid. Okay, so we talked a little bit about alcoholism. So that's when you can't start your day without alcohol, you can't end it without alcohol. You consume alcohol every day for an extended period of time. People like this become tolerant to the effects of alcohol, so they need to consume more to get the same effect that they like. When a person is dependent on alcohol, they develop withdrawal symptoms within 2 to 3 hours after their last drink. So when I can have a drink and then not drink for weeks and weeks, a person who has an alcohol dependence will take a drink, and in 2 hours they need another drink because they will start to feel these symptoms, which is sleeplessness, tremors, nausea, seizures, and delirium tremens, which is, I just had it. The definition for delirium tremors, they occur 5 to 6 days after drinking, stops, and anyway, so a symptom of DT is hallucinations. So you're seeing things that aren't really there. And you also have like extreme confusion, fever, and a racing heart. And if left untreated, can result in death. So that's the most serious symptom of the most serious withdrawal symptoms. Chronic use of alcohol may lead to depression. Depression may also lead to chronic alcoholism. It's a hand-in-hand kind of thing. A lot of people consume alcohol because it makes them feel good. So a lot of people who suffer from depression, anxiety, any other mental health concern will resort to drinking because it makes them feel better, which if you have depression already and drinking, it's only going to worsen the effects because it's a depressant drug. So basically, yeah?
I have something with the last one before this one. So when you like that, the last one we were just talking about, when you're delirious.
Yeah.
So it's kind of like like a drug that we learned about it last year in VIP. It's kind of like a mushroom thing.
Yeah, no, definitely it is. That's a good connection. It is like you're taking another drug that causes hallucinations, like mushrooms or LSD, those kind of drugs that cause you to become delusional. You see things that aren't there. That's where you hear people jumping off of bridges because they think they can fly, that kind of thing. But that's basically what it is. You have hallucinations, and it could be deadly, right? Yeah, so back to diagnosing the alcohol dependence. Really, you have to be forthcoming with this information. You have to tell people, you have to tell your doctor, I think I suffer from alcoholism. I can't get through a day without drinking. If you don't do that, they're never gonna know. So basically, if you do that, to diagnose them, you go to the Diagnostic and Statistical Manual of Mental Disorders. It's a big, thick manual. Maybe some of you guys will see it in the future. It's huge. It has every single mental disorder you could possibly think of. And it's got alcohol dependence. So basically, in order to be diagnosed with it, you need to have 3 of these following symptoms. So tolerance, withdrawal symptoms, which we just talked about, drinking more than intended. So I only planned to drink 2 glasses of wine, but I then had 10 more, kind of thing. Unsuccessful attempts at quitting. So you plan to quit and you plan to quit, but you just never get there. Spending lots of time drinking, giving up activities. So you have to seek treatment for yourself, basically. You need to admit that you have a problem, or you need someone to basically force you to seek treatment. And there's several different treatment. There's detoxification, which you go and you detox your body, which helps you manage your withdrawal symptoms. There's psychological counseling, Alcoholics Anonymous, which I think everyone's heard of. There's oral and injected medications. So there's medications that you take that will make you sick if you consume alcohol. Not in a way that you consume too much alcohol, but in a way that just says, "Oh, I don't like this, get it out of my body." You can do treatment for medical and psychological problems, yeah?
So pretty much it's like when you have medicine that you're supposed to take on a daily basis, it's something's already wrong with you.
Yeah.
And you drink alcohol with it, it kind of makes you sick and feel.
Yeah.
So you don't have the medicine.
Yeah, exactly like that.
Okay.
And then residential treatment therapy. You can go to a rehab and do all of this all at once, right? And then this is a really important factor. This is why some people abuse alcohol. There's protective and risk factors to this. The risk factors are the things that make you at risk of developing alcohol dependence, and the protective factors are things that protect you from developing this. So risk factors include age, family history, like we already talked about, mental health concerns like depression and stuff like that. Social and cultural factors. If you belong to a culture that alcohol is plays an important role, you're going to drink more because of your culture. Mixing medications and alcohol, steady drinking, and early childhood behavior problems. So some protective factors are success in school, some positive peer relationships. If you're friends with people who don't drink, you're probably not going to drink. A positive family life. If you can talk to your family about this, if when you get to that point, like in that video where yourself or one of your friends is in danger, if you have a positive family life, you can call someone and it'll protect you in the long run. Sense of self-esteem and developed social skills are all important. There's a TV show that I encourage you guys all to watch on your own time called Intervention Canada. It's a very graphic show, so I would suggest getting your parents' permission. But it talks a lot about this, about how different drugs, not only alcohol, but like cocaine and all heroin and all these kind of drugs, how it impacts their lives. And it shows some of the risk factors and the protective factors. It's a very interesting show, but it can be quite graphic, and it really gives you a first-hand look on what it is to be a drug addict. And that is it. So I will stop the video, and anyone else can answer any more questions if they have any.